Imagine this, just one single pill to manage a chronic illness. It sounds almost too simple, right? But it could be a massive game changer in healthcare. Today, we're diving into a huge investment that's trying to make this a reality for millions of people in India and, just maybe, the rest of the world. If you or someone you know is managing a long-term health condition, this probably looks really familiar. That little handful of pills, the complicated schedule, the constant reminders, that whole routine is a daily reality, and it's surprisingly easy to mess up. And look, this isn't just about one person's hassle. It's a massive public health challenge. When a treatment plan gets this complicated, it actually becomes less effective, and that creates a huge roadblock in managing some of the most common chronic diseases out there.
All right, so let's dig into the heart of the problem here. We're seeing an absolute explosion of what are called non-communicable diseases. Think heart disease, diabetes, all across India. And this has created a really urgent need for better, simpler, and more manageable ways to treat people.
Okay, so this is what the experts call the compliance problem, and it's a huge deal. You see, treating these conditions isn't a quick fix, it's a lifelong thing. And when you're asking a patient to take a bunch of different pills, maybe at different times of the day, it becomes incredibly hard to stick to the plan perfectly. This is what's known as poor patient adherence, and it's a major reason why treatments that should work, well, sometimes don't.
So, if the big problem is that things are just too complicated, what's the answer? Well, it's got to be simplicity, right? And that brings us to what's being called the one-pill solution, which is all built around something called an FDC.
So what in the world is an FDC? Honestly, it's simpler than it sounds. Think of it like a 2-in-1 shampoo and conditioner, but for your medicine. Instead of taking one pill for your blood pressure and another for your cholesterol, an FDC just combines the active ingredients you need into one single, easy-to-take pill.
And this chart just lays it all out, plain and simple. On the left, you've got the old way. A whole handful of pills, a schedule that's tough to follow, and a really high chance of accidentally missing a dose. But on the right, with this FDC therapy, it's one pill, a simple routine, and a much higher likelihood that patients will actually stick with it. That doesn't just improve their health, it improves their whole quality of life.
Okay, so that brings us to the big player in all this. There's a French pharmaceutical giant that is making a massive bet on this exact idea, and they've decided to place that bet right in India.
And when I say massive, I mean it. We're talking about an investment of over 150 crore rupees. Now, that's not just pocket change. That's a huge statement that shows they're seriously committed to this strategy.
To be specific, that company is Servier. And they're not just throwing money around. They're putting it directly into developing and producing these single-pill fixed-dose combination therapies right inside India, for patients in India and, as we'll see, beyond.
But you've got to be asking, right? Why India? And why is this all happening now? This wasn't a random choice. It's a super smart, carefully calculated, strategic move.
Well, it really boils down to a few key things. First off, India is already one of Servier's top 10 markets in the world, so they know the place well. Second, this investment lines up perfectly with the Indian government's Make in India push. And third, and this is the really big part, the vision is global. The goal is to make India the central manufacturing and export hub for these new medicines.
And you don't have to take my word for it. Listen to what the managing director of Servier India, Frederick Sassini, had to say. He really gets to the heart of it, that at the end of the day, this is all about the patient. It's about getting better health results and improving lives by making these simpler, innovative medicines easier to access.
Okay, so what does the future look like? What does all this actually mean for patients, both in India and, well, everywhere else? Let's check out the roadmap.
They've got a really clear 5-year plan. Step 1, that big investment we talked about. Step 2, they're targeting the heavy hitters, cardiovascular disease and diabetes. Step 3, they're planning to launch about 10 new FDC products. And finally, Step 4 is all about establishing India as the global hub for this kind of therapy.
And that's not just talk. When they say a global hub, they mean it. The plan is to ship these made-in-India treatments all over the world. We're talking Southeast Asia, Latin America, Africa, you name it. This is way bigger than just a domestic project. It has a truly global footprint.
So, when you boil it all down, here's the big takeaway. What we're seeing is a major strategic shift. This entire initiative is designed to transform India's role from being just a huge market that consumes medicine to becoming a global leader that actually produces and innovates these advanced, patient-friendly therapies.
Which brings us back to that powerful final question, doesn't it? We started with the simple, everyday problem of juggling too many pills.
But as we've seen, the solution could have absolutely massive implications. So, could one single pill, made right there in India, truly revolutionize how we manage chronic disease, not just at home, but on a global scale? It's a huge thought, and the next few years are going to be absolutely fascinating to watch.